Important image-based question paper for AIMS, RRB, ASIC, JIPMER, all competitive exam. Even for students also it will be useful. Let's see the questions. First question, identify the following picture it is. Option A, brachial artery catheter. Option B, fistula. Option C, IV cannula. Option D, that is PICC line it is. So can you look at the picture? It is, what is that it is? Can you guess it that? Yeah, what is that? PICC, perineally inserted central catheter. It is used for mainly long-term intravenous antibiotics, nutrition or medication, and also blood draws it is. Blood draw means it is related to the blood collection procedure. Have you understand the question? Okay, move on to the another question. Identify the following machine it is. Option A, hemodialysis. Next, option B, plasmapheresis. Option C, blood thinner. Option D, autolyzer it is. So what is the picture it is? Can you look at the picture it is? Now you are able to understand the questions? Yeah, it is. What is that? Plasmapheresis machine. It is a procedure that remove the harmful substance from the blood by separating plasma from blood cells. It is also known as plasma exchange. In this procedure, we are going to remove the blood cells and also some of the stock substance and sometimes leukemia like that cases. We are going to do the exchange of the blood. That's why it is called it as plasma exchange it is. Okay, have you understand the questions? Next question. Identify the following picture it is. Option A, urine protein analyzer. Option B, IR thermometer. Next, IR phototherapy or transcutaneous bilirubinometer it is. So what is the picture it is indicate that it is? Can you check it there? Yeah, the correct answer is transcutaneous bilirubinometer it is. It is a non-invasive device that measures bilirubin level in the screen, and also it used to screen for jaundice in newborn and infant. So we can check it without any blood sample. We can able to analyze the bilirubin level from the body it is. That's why it is called it as transcutaneous bilirubinometer it is. Okay, got it now? Okay, move on to the another question. If you want more question, you can follow the WhatsApp channel and also YouTube channel it is. Okay, identify the following pictures. HEPA filter, HME filter, nebulizer, steam filter. From this we can able to say it is not a nebulizer or steam in filter. Okay, fine. Then it may be the HEP or maybe the HME filter. So now you identify what is the image it is. Can you guess it that what it will be? Yeah, the correct answer is HME, can stand for heat and moisture exchanger, a device used to humidify and also warm inhaled air or home medical equipment. It's look like a upper airway tract, how it is going to be cleared the all the waste and dust particle should not enter inside. So just like a humidifier, it was working as a humidifier. Okay, got it now? So that is why it is called as HME it is. Okay, next move on to the another question. Can you look at the pictures? Okay, identifying the following. So it is one of the traction it is. Okay, Smith traction. Option B, Dunlop traction. Option C, Gallows traction. Option D, Bucks traction. Can you tell me it is what type of traction it is? The correct answer is Dunlop traction it is. It is used for supracondylar and transcondylar fracture in the children. Used when closed reduction difficult or traumatic. So forearm skin traction with weight or upper arm it is. Elbow was flexed at 45-degree angle. So that is why we are going to use this Dunlop traction. Commonly we can say that in the forearm fracture and the epicondylar, that means elbow fracture was there, means we are going to use this Dunlop traction it is. Have you understand that this question? The fracture was there in the elbow and forearm it is. Along with the traction, what are things we are going to use? Strength traction to maintain the arm position and the selector traction. So both we are going to maintain with the weight lift. So don't forget weight also, and the degree is 45-degree angle we got to use for this traction it is. Got it now? Mostly we are preparing for the child it is. Okay, next move on to the another question. Identify the following image it is. It is, what is the picture? Can you look at the picture? Yeah, it is a curved scissor or laser scissor or braided scissor or hawkers forceps. Actually, we are using for the scissor for long time in the hospital, but we must know the name of the scissor it is. Okay, you tell me what is the name of the scissor now. Lizard scissor. It is otherwise called it as bandage scissor. What is the purpose? It is cutting and removing dressing and also bandages, medical materials without hurting the patients. It is how the scissor look like. It is one side will be plain sharp and another side will be flattened and blunt tip will be there. So that is a difference between episiotomy scissor and laser scissor. Now you can look at the scissor both. It is which one it is? It is a episiotomy scissor, that another is a laser scissor. Okay, now you got to understand the point. It is okay. Move on to the another question. What is the name of the bandage? It is okay. Identifying the following image. Option A, gauze pad. Option B, spiral cotton. Option 3, Kumji pad. Option D, combined dressing it is. So what is the name of the bandage it is? Yeah, it's a correct answer. What is that it is? Kumji pad it is. Also, it is otherwise called it as Kumji tissue or pad or absorbent medical dressings used for wound care, padding and absorbing exudate it is. I think you have understand the question and answer. Okay, move on to the another. See what is the picture indicates. It is ethylene clear monofilament 2, that is 75 centimeter it is. Okay, so now you tell me what is that it is. It is an absorbable natural sutures. Option B, it is a non-absorbable natural sutures. Or option C, it is an absorbable synthetic sutures. Option D, it is a non-absorbable synthetic sutures. Can you tell me what is the correct answer here? That is ethylene monofilament it is. Okay, what is the correct answer here? Yeah, option D, it is a non-absorbable synthetic sutures. That is option D will be the correct answer. Next question, can you look at the pictures? Okay, now you tell me what is the type of bandage it is. Okay, fine. It is option A, POP, that is plaster of Paris. Option B, fiber cast bandage it is. Option C, cotton bandage. Option D, polyamide cast bandage it is. Now you tell me what is the correct answer here? Yeah, what is that it is? It is one of the fibrocast bandage. How we are going to use a plaster of Paris? It is taking too much of time. Instead of that, we can use what is a fibrocast bandage. We can easy to be applied for the health worker it is. Okay, but the same procedure as it is. This both picture will indicate that fibrocast bandage and plaster of Paris it is. I think now you are clear about the doubt it is. Okay, fine. Next, move on to the another question. Okay, now look at the pictures. So what is that it is? Option A, humidifier. Option B, T-piece. Option C, catheter mount. Option D, venti circuit it is. So what is the correct answer? Can you guess the picture and tell me now? The correct answer is catheter mount. Okay, what is the uses? It is used for medical connector used to attach a breathing system to a patient respiratory system, specifically endotracheal or tracheostomy tubes, minimizing jerk and trauma to the tracheitis. So that is why it is called it as catheter mount it is. I think now you are understand the question and answer. We can move on to the another question. If you like this video, please like and subscribe channel and also follow the WhatsApp channel and Telegram channel. Okay, identifying the following images. It is called it as option A, CT machine. Option B, Foger machine. Option C, CM machine. Option D, orthopedic honk it is. So what is the correct answer? Can you tell me that it is? Yeah, what is that it is? Looking itself, we can able to find out that it is C-arm machine it is. Okay, so the correct answer is C-arm machines. What is the use? A C-arm machine is a medical imaging device used in surgical settings, providing real-time X-ray images to help surgeon visualize internal structures and guide interventions, particularly in procedure like orthopedic surgeries, cardiac procedures and pain management. So that is why it is called it a C-arm machine it is. Okay, next move on to the another question. Identify the number of surgical blade it is. So look at the picture, that is surgical blade. So what is the number? Option A 11, option B 12, option C Option C 15, option D 22 it is. So what is the correct answer? So it is a number 15 it is. It is one of the surgical blade. It is small curved cutting edges. It is ideally used for precise incision like surgical procedures including dermatosurgery, excision of skin lesions and delicate procedures requiring precision it is. These are the uses of surgical blade number 15 it is. Okay, next move on to the another question. Before that, please like and subscribe our channel. Identify the name of the instrument. Option A, scissor mount. Option B, surgical blade. Option C, suture handle. Option C, scalpel handle it is. So what is the correct answer? Can you guess it that it is? Yeah. Scalpel handle is the correct answer. They are used for surgery, dermatology, taxidermy, veterinary medicine, podetary. And also there are different types of handle also. They are long, skinny, ergonomy, beaver, scalpel like that. So and also there are different grip techniques also. There pencil grip, palm or violin, finger grip. So you will study and understand all the different kind of this. Okay, I think it will be useful for you. Okay, next move on to the another question. Look at the picture. Identifying the following images. So option A, skeletal traction. Option B, skin traction. Option C, bucks traction. Option D, Dunlop traction it is. So what is the correct answer here? Can you guess that already we have seen the Dunlop traction? That means it is not a correct answer. Okay, it is a skin traction. That is a correct answer. It is a procedure that involves pulling on a limb to realign the bones and also reduce pain and treat soft tissue injuries. It is often used as a temporary treatment after trauma it is. So that is why it is called as skin traction. That is superficial traction it is. Okay, now you understand that answer? Okay, fine. Next move on to other questions. Next, identifying the following images. So option A, Humovac train. Option B, pigtail train. Option C, Penrose train. Option D, T-tube train it is. So what is the correct answer? Humovac train it is. So it is, what is the use? It is a closed suction system used after surgery to remove fluids and also like blood and other body fluids from a surgical site, promoting healing and minimizing the infection risk. I think you have cleared the doubt of this Humovac. Okay, next to move on to the another question. I think you will come to know the picture it is. What is that it is? The image indicate kyphosis, lordosis, scoliosis, none of the above. So you can see the curve where it was there. Which curve it is? Sideway curvature. Now you look at the normal spine and abnormal spine. That is scoliosis. So you can see how they are it is. Scoliosis is an abnormal sideway curvature of the spine, often appearing as an S or C shape, but that can affect the people of any age but commonly develop during childhood or adolescence it is. So this is called it as scoliosis. Like this video, please like and subscribe our channel and follow on the Nurse Genius app also. Okay, option A, DTH. Option B, club feet. Option C, rickets. Option D, osteomalacia. It is one of the congenital disorder. It is called it as club foot it is. A birth defect characterized by a twist of foot, a high arch in the midfoot and forefoot turn inward, a heel tuned turn into inward and hind foot pointed downward it is. So that is why it is called it as, what is that, club foot it is. For this we can able to do the surgical operation to resolve the problem of the club foot. So it will be correction procedure also available in the orthopedic surgeries. Okay, now you understand that. Okay, next move on to the another question. Identify the pictures. So it is what type of the fracture it is. Option A, Galaxy fracture. Option B, humerus fracture. Option C, carpal fracture. Option D, monetizer fracture it is. You now you tell me that what type of fracture, where it was there. It is there in the hand it is. Now you confirm it. Okay. It is called it as monetizer fracture. It is a rare forearm injury that involves broken ulna and dislocated radial head it is. So that is why it is called it monetizer, because it is first discovered by the monetizer. That is why it is called it as monetizer fracture it is. I think now you understand the question and also answer. Next move on to the another question. Identifying the following image. It is a Humovac train or pigtail train or Penrose train or Jackson Art train it is. Can you look at the picture? Already we have seen the Humovac train it is. That means it is not a Humovac train it is. Now you tell me what is a train it is. It is called it a jackpot train. It is a Jackson Prot train. It is also closed suction medical device used to forced surgery to collect excess fluid from the surgical site. for reducing swelling and the risk of infection it is. So that is why it is called a JP train or Jackson Brad train it is. I think you have cleared the doubts. Okay, now we can move on to the another question. Identifying the following image, it is indicating that oxygen face mask, option B partial rebreather mask, option C non-rebreather mask, option D venturi mask. Can you look at the picture clearly? Now you will understand what is the question here. Okay, now you tell me the answer. What is the mask it is? There are different mask is available. Simple face mask, partial rebreather mask,